Hi, I'm Dr. Tony Mork, board-certified orthopedic surgeon, endoscopic spine specialist practicing in Newport Beach. I'm also proud to say that I've been active on the speaking circuit at some of the local and county chiropractic association meetings, as well as the national meetings like Pro Sport in Las Vegas. And today, I'd like to ask you a question. How many MDs know that the most popular treatment for back pain is from a chiropractor? In a survey of 14,000 patients, consumerreport.org noted that the most popular treatment by patients polled in the study was chiropractic treatment. Let me ask you another question. Do you ever send patients out with the expectation of fusion surgery because you don't know that any other alternatives exist? Well, I'd like to share with you some of the alternatives that endoscopic spinal surgery may give to you, with an additional benefit that a patient treated with endoscopic decompressive surgery can actually return to your practice within at least 4, 6, or 8 weeks of the surgery for your continued treatment. And I know that this is something that's not likely to occur if your patient has had a fusion type of a procedure. I want you to consider signing your name and email address to sign up for the dcnewsletter.com. In this monthly video presentation, I've taken an interesting patient or problem that I've faced in the office and tried to make a video about some of the anatomy or some of the different ways to look at an MRI scan or CT scan or maybe spinal pain mapping injections. Some interesting aspect about working up a patient who had kind of a tricky diagnosis or maybe a problem that wasn't really discovered or had just gotten worse with conservative treatments such as hands-on therapy that you might offer. I hope to review just some of the interesting aspects of things like spinal pain mapping and maybe how to look at and maybe treat something really tough like an annular tear of a disc. So if these things sound interesting to you and maybe I can shed some insight, I'd love you to sign up for dcnewsletter.com with your name and email address, and I can give you a monthly update and a short video talking about things that maybe you don't think of normally in your day-to-day practice. You and I have the same problems lurking in our offices. I might just have a little different perspective on it than you might. Thanks.